You know, the earlier we find a health problem, the better off our chances of fighting it. Today, we're learning about some new tests to uncover diseases that often go unnoticed.
Let's bring in the Fox Medical Team's Dr. Joette Javinko. She joins us live from our Tampa newsroom. Dr. Joe, let's begin with the big ones. You're hearing about some new cancer testing.
Yes, and it's really exciting, and the technology is getting so advanced. And the first one is cervical cancer. And this particular test is coming out of Louisville, and what it does is it looks for a thermogram or a heat profile of the protein that's circulating in the blood for cervical cancer. And not only can it pick up the cervical cancer, but they say that it can also kind of tell you how aggressive it is. And that's what's so amazing, because it's all from a blood test. That test also implements something else called mass spec, and they say with those two things together, they're also picking up melanoma, so that's going into phase 3 trials, ovarian cancer, which is a tough one as we know, and then also other things like amyotrophic lateral sclerosis, big name ALS, and lupus, and other things like that. You know, one of the other things that they're also looking at is a test for lung cancer. This is coming out of Italy, and they're saying that this blood test can pick up lung cancer up to 2 years before a scan can. Now, we know that scans can help us, and they're helping everyone by getting those CT scans. Heavy smokers should be asking their doctors about those. But if this lung blood test comes into play, they're saying that it may hit the U.S. within the year.
That is amazing. Now, Doc, a lot of people are on this gluten-free kick nowadays. There apparently is something new to diagnose celiac disease as well.
Yes, this is coming out of Australia, and this new test allows someone to be tested if they've been eating gluten for just 3 days. Now, let me explain why that's important. Gluten affects our immune system, so if someone's sensitive, it makes the white blood cells attack it, and then it also attacks the body. It can cause all sorts of symptoms like nausea, vomiting, bloating, anemia. So a lot of people get off the gluten, and then they have to go back on it for a period of weeks before they can get tested. This test is going to allow them to get to be accurate within 3 days of eating gluten. So they only have to go back on that bad diet for about 3 days. They say that it's very accurate in the sense that if you don't have it, it's going to be negative, and it picks up the vast majority of people who do have celiac disease. Now, some people don't have celiac disease, they just have sensitivity. Those people would be negative, but then, you know, they could maybe maintain themselves on the diet, but at least they'd know that they didn't have celiac disease.
Great information. We're so glad you're looking out for our health. Thank you so very much, Dr. Joette Javinko in Tampa.
Thank you.